The state's reporting a record number of new cases, nearly 6,500 new infections. Even with almost 700 cases added in because of a backlog, it's still our highest one-day number to date. And the number of high-risk communities is also going up. 97 cities and towns are in the red, which is up from 81 last week. Hospitalizations are also up. Sunday, the DCU Center in Worcester opens again as a field hospital. And today, the governor announced that a second field hospital will open in Lowell. Kristina Rex is in Worcester tonight, where healthcare workers need help.
This massive surge in cases increases the state's need for field hospitals. This one at the DCU Center in Worcester will open on Sunday, and more are being prepared. Now, the state needs doctors and nurses to staff them.
If you have the skills, the ability, the can-do attitude, and have time to work in a hospital, we need you.
Daily COVID-19 cases in Massachusetts are at an all-time high. And as Governor Baker toured a Worcester Field Hospital, he said it's only going to get worse over the coming months.
The good news is that medical professionals have gotten a lot smarter and a lot better about treating people who are dealing with COVID.
We have ventilators in here.
Hospitalizations are nowhere near last spring. But to prepare, this Worcester Field Hospital is ready for 220 COVID-19 patients.
Very big learning experience and adapting nonstop.
Grant Lewandowski helped at this field hospital during the first wave. He was allowed to graduate early from med school to help. And now he's heading into a month-long residency in the intensive care unit at what will likely be the peak of the pandemic.
Cautiously optimistic, I would say, apprehensive for sure. There is a lot of responsibility and a lot of, unfortunately, sick individuals.
The city of Worcester has a 22% COVID positivity rate this week, way above the state's average. That prompted UMass Memorial to pull back on elective procedures. The same is happening at Lawrence General.
I think over the last 2 to 3 weeks, we've seen our numbers probably triple or quadruple in terms of the patients that are being admitted to the hospital who are COVID positive and are ill from the disease.
There's hope a second field hospital the governor just announced in Lowell could help with the strain. And to prepare, the state now needs any medical staff willing to work.
The size and magnitude of these efforts require all hands on deck.
The field hospital here at the DCU Center will open on Sunday, and staff training will begin Friday morning. In Worcester, Kristina Rex, WBZ News.